Hello, everyone. My name is Sunny Scott, and today I will be presenting my Applied Healthcare Quality Improvement Project, Improving SEP-1 Bundle Performance Across Sutter Health. This project focuses on improving sepsis care at Sutter Health by increasing compliance with SEP-1 guidelines and reducing treatment delays. Sepsis is a time-sensitive and life-threatening condition, so improving early recognition and timely intervention is critical to improving patient outcomes. The quality problem identified in this project is the inconsistent adherence to SEP-1 sepsis bundle guidelines with compliance rates around 65% at Sutter Health. There are also delays in key interventions such as antibiotic administration and early recognition, which can negatively impact patient outcomes. Sepsis is one of the leading causes of mortality in hospitals, and because it progresses rapidly, timely and coordinated care is essential. The goal of this project was to improve SEP-1 compliance from 65% to 85% within 12 months by standardizing workflows, improving patient education and staff education, and continuous monitoring. This gap in compliance is critical because sepsis can progress rapidly, and even small delays in treatment can increase the risk of complications, longer hospital stays, and higher mortality rates. Also, provider responses and workflow processes made it difficult to ensure consistent high-quality care across patients. To address these issues, the Plan Do Study Act, PDSA, was used to guide the quality improvement process. This approach allows for continuous, data-driven improvement and helps identify gaps in care delivery. Several tools were used, including the electronic health records data, dashboards, and run charts to track progress over time. The analysis revealed workflows inefficiencies, treatment delays, and variability in provider responses, highlighting the need for standardized processes. Also, the PDSA cycle allowed for small, manageable changes to be tested before full implementation, reducing risk and improving effectiveness. Using data from dashboards and run charts helped identify patterns over time, rather than relying on single data points, which made the analysis more reliable and actionable. During implementation, several targeted interventions were introduced. These included staff education and training, standardized sepsis workflows, implementing EHR alerts for early identification, and clearly defining team roles. Staff education focused on recognizing early signs of sepsis and understanding their role in timely intervention. Standardized workflows reduce confusion and ensure each step in the process was followed consistently. Clearly defined team roles improve communication and accountability during patient care. As a result, these interventions improve SEP-1 compliance from 65% to 85%. There are also reduction in time to antibiotic administration and improved adherence to sepsis protocol. Run charts demonstrated a clear upward trend in compliance and a downward trend in treatment delays, showing the effectiveness of the interventions. These improvements reflect better adherence to protocols and more timely patient care. On this slide, we see the data supporting the project's results. As you can see to the right, the run chart at the top shows a steady increase in SEP-1 compliance over time, while the bottom chart shows a reduction in time for antibiotic administration. These trends are important because they show sustained improvement over time rather than a one-time change. The consistency in the data suggests that interventions were not only effective, but also integrated into daily clinical practice. Together, these trends demonstrate that the intervention was effective in improving both compliance and timely care. So, to sustain these improvements, several recommendations were identified. First, ongoing monitoring using dashboards and run charts is essential to tracking performance. Improving EHR alert systems can help reduce alert fatigue and ensure timely responses. Continued staff education and training will also support long-term adherence to protocols. Leadership involvement is essential to maintaining accountability and ensuring that improvements continue over time. Addressing challenges such as alert fatigue will be beneficial to prevent staff from becoming overwhelmed and missing important notifications. Moving forward, the initiative can expand across departments with increased leadership involvement and the use of predictive analytics to identify at-risk patients earlier. In conclusion, this project demonstrates that implementing and standardized protocols and using data-driven strategies can improve sepsis care. SEP-1 compliance increased to 85%, exceeding national benchmarks, and delays in treatment were reduced. Improved timeliness of evidence-based interventions and enhanced clinical outcomes and patient safety. This initiative reduced variability in care, strengthened teamwork, and improved the quality of patient care. This project highlights how structured quality improvement efforts can create meaningful and measurable change in patient care. It also reinforces the importance of collaboration, data utilization, and leadership support in sustaining improvement. Overall, this project reinforces Sutter Health's ability to improve sepsis outcomes through coordinated quality care. Thank you, everyone.